Hello, my name is David Turnberger, and I am going to be doing my first attempt at my intraosseous medication administration. Due to not being able to due to not being able to go into the lab, I have tried to improvise as best as I can. So this is the leg that I'll be using. I tried my best to draw it out as best as I could. So in regards of the skill, the first thing that I'm going to do is gather up all my equipment, and then I will inspect my equipment, starting off with my IO drill, make sure that it works. Okay. Then I'll come over, grab my IV solution. I'll be checking it, check the expiration date. I'm going to look at the clarity, see if I'm going to be observing for the dosage calculations and making sure that this is the right IV medication. Then I'm going to be inspecting my tubing, making sure that there's no twists. Okay, all good. Make sure that I have my handy dandy little IO needle set up. Also got a flush. I got an alcohol prep pad. I have my bulky dressing. We are ready to go. So I'll start off putting on my PPE. And then also, as I am inspecting my medications as well as my IV tubing, I'll make sure that they have both of their tail ports. Remove the tail port. Going to come over, remove the protective cover on my IV tubing. Going to spike my bag, flip it upside down, fill my drip chamber about halfway. Going to come down, open up my IV tubing, make sure that all my air bubbles are out. Okay, I don't see any more. Going to close my IV tubing, hang my bag, set that aside. Okay, the next one I'm going to do is I'm going to come over to my patient. I'm going to landmark where I'm going to want to be placing my needle. So I'm going to be going 2 fingers down, 1 finger medial. So I'm going to be wanting to give it about right here. So yet again, so I'm going to be going 2 fingers down, 1 finger medial. So about right there. And then I will prep my patient. So I'm going to start in the center, and then I'm going to keep on working out. Okay. And then I'm going to go parallel with the bone, going to be going at perpendicular with the bone, going to be going in at a 90-degree angle. And then if my patient is awake, I would want to make sure, if my patient is conscious, I would want to make sure that I give them a lidocaine solution to try and numb the area, because this is somewhat of a painful procedure. Okay. And then I would insert my needle until I started feeling resistance or the area started to become really tight. And then what I would do is I would, so there would be a stylet on top of the needle. I would remove the stylet, place it in the proper receptacle. I would then take an IV flush and I can attach it to my attach it to my IO needle, and then I can draw back. And then if I see blood, I know that I have had proper placement and that I'm in the bone. Plus, I can continue to draw back, put a cap on this, and then I can send this to the hospital, and they can be able to use that blood for testing if they ever need it. And then I will inspect the area for burrs as well as anything else. take my padding, go and stabilize the needle, attach my IV tubing, open it, assess for the proper drip rate, and then I'm going to monitor my patient for desired therapeutic side effects, and then monitor my patient for any changes and clean up my area, and we will move on. Thank you.